This week on 3 Qs at the U, we're speaking with Professor Peter Newman from the Factor in Wentash Faculty of Social Work at the University of Toronto. Hi, Peter.
Hi, Sam. Thanks so much for having me on.
Sex and dating can be complicated at the best of times. Throw a pandemic into the mix and things can get really complicated. How has the one-size-fits-all approach to public health created challenges for folks in LGBTQ2SI+ communities?
LGBT communities are experiencing a lot of disparities in terms of mental health and health before this pandemic ever existed. So when that's not considered in terms of the pandemic response, then telling people certain things about staying at home and avoiding contact with people outside their household is a very different experience for someone who has a nuclear family around them than for, a gay man living with a partner and one of them's not out to the family. And they usually can navigate that. But now they're both stuck at home, how are they going to do that? And, on and on in terms of situations so that it's not considered in terms of how might this impact them. Also, higher rates of depression, suicidality, even heart disease, actually, HIV as well, create conditions that are going to make it more difficult when you don't have equal access to competent healthcare, where you feel stigmatized in the healthcare system. So these all pre-exist the pandemic, but if they're not considered in the response, then the very things you're being asked to do are sometimes alien and further marginalized.
How has the pandemic impacted queer folks living with HIV? Have there been an increase in health challenges or complications due to the pandemic?
When people living with HIV now are having obstructions in their access to their medicine for a variety of reasons, like the clinic has been repurposed for COVID now, and they have to travel twice as far. They're concerned about their own health, as would any person with HIV or not. Do I really want to go to the doctor right now? Do I, just to get my medicine? So if access to your medicine is reduced or obstructed, it's not only a serious threat to your own health, it's a serious threat to the advances in prevention at a community level, at a population level that we've made over the past couple of decades. It creates a whole other layer of obstacles that we really hadn't had to deal with. We thought we'd handled those, largely for parts of the community that are all coming back. So there's a big threat to this momentum that's been happening towards halting the epidemic among at least some communities by 2030. Like the UNAIDS goal is seriously in jeopardy now amidst this pandemic.
As a researcher in this field and someone passionate about these communities, how are you looking to celebrate, mobilize, and promote resilience this Pride Month?
It's a community that's built up tremendous strengths in terms of resilience in the face of adversity. How do you navigate these challenges? And I don't mean to be glib about this at all, but the gay, lesbian, across the board LGBT communities have been a massive force in the success of 30 plus years of a response to HIV. We would nowhere be where we are now without that. The route of transmission is different. It's a different pandemic, but I would venture to say we know how to do pandemics, actually. And the experience of the community is really, really important, frankly, in terms of how do we navigate this one. But just add that a very important element of that is celebration of victories. Not only how do we prevent a disease, but how do we keep a vibrant community that maybe can't go into various spaces. It's really important to really navigate virtual spaces. That type of peer support and community building and solidarity is frankly an antidote for some of the symptoms of anxiety and depression and loneliness. And just acknowledging our victories in the past and hope being so important, like we've done it before, we can do it again.